Where is she? Oh my gosh, Karen, what the heck? I've been waiting for like 20 minutes.
I know. I lost my keys. I couldn't find them, and then I almost missed a turn coming to work. It's happening all the time. It's driving me crazy.
Well, you know I have this problem. I have to pee all the time. I cannot sit here and wait. I had a cup of coffee and now I need to pee.
Oh my gosh, I know. But you need to go see Gabby. She's a pelvic floor physical therapist, and she fixed that for me. But now, like that, my bladder's fine. But now I wake up. I either can't sleep. I wake up, and then I wake up in a pool of sweat.
Oh, that happened to me too. Girl, I told you. Did you try that magnesium I saw on TikTok?
Yeah, but then it gave me diarrhea.
I know it gave me diarrhea too, but you know what? My husband, he's so constipated. He gets up 2 times a night to pee. That wakes me up too. And he's constipated all the time and spends so much time in the bathroom. I'm sure it's on the
The
phone.
bone. Yeah.
Yeah.
He needs to see a pelvic floor physical
A
therapist.
pelvic floor physical therapist?
Yep, they can fix all of it. She helped my husband. Now he just wakes up and he wants to have sex, and that is a hard no.
I got my libido back on track. You know what? I saw this girl. Her name is Jennifer. She's in Rockville and she works with hormones. So now I'm on all the things. I'm,
Hormones.
yes, hormone replacement. It's not as scary as you think. And she's really, really nice. She listens to you. And I heard that Gabby girl, you told me about this Gabby girl. Can she help me and my husband at the same time?
Oh my gosh, yes. It'll be great. She does men, women. She has practice that treats men and women. Yeah, definitely.
What about my husband's shoulder? He started lifting weights again, and now all he does is complain about this hurts, and I'm sore all over.
Yeah. No, you guys should do a couples one. They do neck, shoulders, all the things, but pelvic floor is their specialty, but they treat everything.
Now, can I be honest with you?
Yeah.
Sometimes it hurts when I have sex. Do you think she can help me with that too? I mean, my hormones are in check. I want to do it, but it hurts.
Oh my gosh, yes. I need to see Jennifer because I just don't have it. But I was seeing a pelvic floor PT and she really helped with the pain. Pain's not the issue anymore. I just don't want it.
Well, I could definitely get you back on track with that. So tell me, does she like touch you down there?
Yeah, but it's not weird. It she explains everything, it makes sense, and it's not a feel good thing, but it really helps.
So my girlfriend was just complaining because she's had the triplets and things got blown out. And now she just has to walk around with a pad and she's worse than me going to the bathroom every 5 minutes. Is that something she could help with too?
Oh my gosh, yes, that is so common. It's definitely not normal. I have friends where they have similar issues, but their pelvic floor physical therapist is also saying that they should have some hormones or like vaginal estrogen. Is that helpful or like, is that just for like menopause?
Well, Jennifer told me that vaginal estrogen is a must-have for all women over about 37. 37. Nobody
37?
ever
Oh my
tells
gosh,
us
she's
this
so
stuff.
young.
Yes, because the tissue starts to thin and that leads to the pain. But you just swap this stuff on down there and it really, really helps. But there's lots of modalities and she really takes the time to explain how to do it. So maybe putting the stuff down there and the physical therapy or the pelvic floor therapy
That
could
would
help
so
both
helpful.
things, right?
Yeah.
They work together.
Yeah. Okay, I need Jennifer's information.
Well, I'll give you Gabby's information, but I do have to warn you, she doesn't take insurance.
Ugh, no insurance.
I
Ugh.
know there's so many good physicians and providers out there, and they don't take insurance. It's so frustrating. Some of my girlfriends complain all the time about that, but I try to tell them when you go to somebody who doesn't take insurance, a lot of times they take more time. I had a rotator cuff problem. I went to physical therapy. It was 3 times a week. That's 3 office visits, 3 copays.
Yeah, that's a
And
lot of
I
time.
heard she can do more in one visit than 3 times a week. What do you think?
No, that's true. I mean, you get the quality care, you get the hands-on time, you get the time with the person, not seeing any rehab aides or assistants, and they know what they're doing. I mean, it's my vagina. I don't want to see someone who hasn't worked on that before.
When I saw Jennifer, her first visit was 90 minutes.
Oh
Have you
my
ever
gosh.
been to a
I've
doctor
never
that goes
sat with
for
a
90
doctor for 90
minutes?
minutes.
I know. And it was real conversations. I could tell her everything. She starts whenever you were born and goes all the way through to
That's
now. And she
incredible.
addresses all my problems. Sometimes primary cares, they can only do one thing at a time because they only have like 5 or 10 minutes.
No, that's so true. Yeah, no, when my husband saw Gabby, she worked on his pelvic floor, she did his back and his shoulder. And I mean, it's worth it. And at the end of the day, it really doesn't cost that much difference. And if you have your quality of life, then that's all that matters.
I think so too. Well, I'll give you Jennifer's
Okay,
information.
I'll give you Gabby's,
All
and
right.
we'll reconvene.
All right, Frank, can you put up can anyone resonate with any of the stuff that we said? Okay, so I have a couple slides here that just sort of reiterate who I work with. So I work with women who are 35 to 65, and I do work with people who sort of miss the boat with hormones. I do put people who are over 60 on hormones. It's just a longer conversation. But most of the complaints are you have fatigue, weight gain, brain fog, poor sleep, all the things that sort of Gabby and I talked about, even stiff joints, shoulder issues. And then I also see men. I do have a male partner, Dr. Neil Spiegel. He's an osteopath and he sees men also. So if you have a partner who's a male and wants to see a male, that's fine. We see men over 40, low testosterone, fatigue, motivation, muscle mass, like if you're at the gym and you're just not making any gains. And then we also see a lot of people with gut issues, long-term constipation. Gabby just sent me a patient who's been constipated since she's 16, so we're working on that.
And she's 50 something now.
Yeah, she's 50. So a referral trigger for me is if anyone says I don't feel like myself, and I want to meet those people who don't feel like themselves. You can go to the next slide. So when you hear I'm exhausted, my labs are normal, but I feel terrible, gaining weight, waking up at 3 in the morning, no sex drive, when you're being gaslit and saying like, hey, it's just you getting older. Or I've been to 3 or 4 doctors and I haven't gotten my answers, or they're just saying and dismissing my symptoms. That's when I come into play. Next slide. And then if you hear they don't take insurance. So there's a reason we don't take insurance. We spend 60 minutes in follow-up. We spend 90 minutes with their first visit. We work for the patients, not insurance companies. We do provide all the information for them to file. But oftentimes one visit with us will replace a primary care, a gynecology, nutrition, hormone consultation, and wellness, because most traditional visits are 10 to 15 minutes. That's why concierge medicine is coming into play now, because they just spend more time, because we are more complex and more complicated, and it just takes a long time to get through and figure out the root cause of why you're having your pain or your problems, and then coming up with a personalized plan just for you. And next one. So this is my partner Neil and myself, and it's about performing and longevity and being older and just being able to run around with your kids and your grandkids. And I just want to live to 90, 100, and 110 and then just die. I don't want to slowly decline. And I hope that I don't have to go to one of the houses. I just want to go and die. So then I'm going to turn it over to Gabby.
Hi, I'm Dr. Gabby. I own functional physical therapy with my husband, Matt. So there's some pictures of us and our family. So that's a picture of Matt and I on our wedding day almost 12 years ago. And those are our 2 kids. We have a 2.5-year-old girl and a 4.5-year-old son. Yes, they are redhead, and you can see now that one of us have red hair. Next slide. So functional physical therapy, like who do we help? Kind of like what we just talked about. So if you have it leaking with coughing, laughing, sneezing, constipation, fecal incontinence, painful sex, urinary urgency or frequency for people who are under 65. If you're up more than once a night peeing, over 65, more than twice a night, that is a problem. Any type of pain. It's not just pelvic pain. It could be neck, shoulder, hip, back, ankle. We do it all. So if you hear people say, no one has helped me, I thought this was normal, we would love to see them. Next slide.
So one thing I'll say about Gabby is if they've been to physical therapy and they're still having problems, that's a good call for Gabby. If they're like, yeah, I've done it 2 or 3 times, or it's just not helping, and I'm back to my orthopedist and I'm still having pain, that's a good referral.
We love those. So yeah, listening for, I thought this was normal. I've never been the same since having kids, even if you had your last kid 20 years ago. I thought this was a normal part of aging. I've tried PT before, it didn't help. Any of these things. A common misconception is, especially with pelvic floor, is my pelvic floor is just weak. 9 times out of 10, your pelvic floor is really tight, which is contributing to the weakness and then the pain. And so you can't strengthen before you lengthen. So you can't strengthen a muscle before you get it back to its normal tension. So if you think about if you get a like a Charlie horse in the middle of the night in your calf, you're not going to jump out of bed and do heel raises. You're going to stretch it out. Same thing. So we look at the whole picture, we get to the root cause, and we can help these symptoms, whether they've been going on for days, weeks, months, or decades. Next slide. So one of the things that we proudly say is you've never had treatment that like the type of treatment we provide here. So our therapists are both certified functional manual therapists and board certified pelvic health specialist, which is less than 1% of PTs in the country. We see a lot of people who have failed physical therapy or other treatments. I don't like that term because it's more the treatment just wasn't right for you. So we look at the whole picture. So we are also at a network for all the reasons that Jennifer said. You always get one-on-one care with your doctor, with the doctor of physical therapy. There's no aids, there's no big gym. You're not going to be in a room with other people. And we just can't do that type of care following insurance guidelines. We provide all the information for you to submit. And so, like I said, pelvic floor is our niche, men, women, teens, but we also treat everything, neck pain, shoulder pain, back pain, especially if you've had it for years and years and years. And I've been to XPTs, X treatments, and nothing has worked. We also do digestive issues like acid reflux, bloating, constipation, and that's a great referral to Jennifer as well because we work hand in hand addressing all of those symptoms. So the three things that we really look at that set us apart, we look at mechanical capacity, neuromuscular control, and motor control. So what are those? Mechanical capacity. Do you have range of motion? Do you have full range of motion of soft tissue and joint? If you don't, there's no point in exercising and strengthening because you're not getting to the right ranges. So we do a lot of hands-on treatment to improve that range of motion. Neuromuscular control basically is like, can you do a motion? Can you lift your arm above your head? And are you activating the right muscles? So that's a lot of problems that we see for people who have failed PT is they're not using the right muscles. So we work on activating the appropriate muscles, working through that, improving that. Then we can work on motor control, which is basically, can you do what you want to do? Can you walk? Can you run? Can you squat? Can you lift your kids? Can you reach overhead? And so every treatment, every time you come in, we reassess those three pillars, which is very unique to functional manual therapy. So that's how we are different. But yeah, we love seeing pelvic floor. We love seeing complex and chronic. So we look forward to working with everyone. And
Nice,
that's it.
nice, nice, ladies.
Thanks so
That was the
much.
that was